Nur 201. Today we'll be discussing diabetes mellitus. And in this, you should have read your McCain, Hurt, and Bradshaw book on pathophysiology. And you also, I'm going to give you a pre-test. And here's your pre-test. And this is basically designed, pre-test is given to you to see if you had to retain any of your knowledge from your reading assignment during the past week. Okay. And question number 1, we should be finished. The best way to take care of your feet is to A, look at your feet and wash them daily. Number 2, if you're beginning to have a low blood glucose reaction, you should C, drink some juice. And 3, numbness and tingling may be symptoms of B, nerve disease. And here's a handout for you to go along with the video that you can take notes. And the goal for this lesson is to learn to be able to discuss the 2 types of diabetes mellitus by the end of the lecture and be able to tell what's the difference in short-acting and long-acting insulin. The learn to be able to identify hypoglycemia and hyperglycemia, signs and symptoms, and how to treat. And 3, to learn to be able to teach patients diabetic feet care. Objectives for diabetes mellitus: to learn to be able to identify type 1 and type 2 diabetes by the end of class. To learn to be able to acknowledge the difference in short-acting insulin, R and log, versus intermediate insulin and long-acting insulin by the end of class. To learn to be able to assess for hypoglycemia and hyperglycemia, and to learn to be able to demonstrate teaching strategies for diabetic foot care. What is diabetes? Diabetes is a disease in which the body's ability to produce and respond to hormone insulin is altered. Causes are malfunctioning metabolism, carbohydrates, and increased levels of glucose in the blood and urine. Type 1 diabetes results from destruction of the beta cells, and which leads to a decline in insulin production and causes rampant glucose production by the liver. The overproduction of glucose production in the liver results in fasting hyperglycemia. Glucose from the food cannot be stored in the liver and stays in the bloodstream. Kidneys cannot absorb the glucose once it meets its renal threshold, which causes glucose to appear in the urine, better known as glycosuria. Excessive loss of fluid from the body goes hand in hand with excessive excretion of glucose in the urine, leading to osmotic diuresis. The fat is broken down into ketones, which is a byproduct of the fat breakdown. Causes of type 1 diabetes is genetics. Genetics plays a role in the destruction of the beta cells in type 1 diabetes, and environment. Exposure to viruses can cause damage to beta cells. And also, it's the most common form of diabetes in children under the age of 12. Clinical manifestations of diabetes type 1, you'll see polydyspnea, polyuria, polyphagia, weight loss, and fatigue. That means polydyspnea means thirst, polyuria means urination, and polyphagia means increased hunger. What are the 2 types of diabetes? Another is type 2 diabetes. It's caused by impaired insulin secretion or insulin resistance. Insulin cannot bind with the special receptors, so insulin becomes less effective at stimulating glucose uptake and regulates the glucose release. There must be increased amounts of insulin to maintain glucose level at a normal or slightly elevated level. There's enough insulin to prevent the breakdown of fat and production of ketones. Now, uncontrolled type 2 diabetes leads to hyperglycemia or osmotic non-keto acid syndrome. And type 2 diabetes is better known as non-insulin dependent diabetes mellitus. And what are the causes of diabetes mellitus? Is excessive weight gain or obesity, insulin resistance, inactivity, sedentary lifestyle, no exercise results in insulin resistance and results in impaired insulin secretion. And type 2 diabetes affects age group from 45 to 67 according to McCain and Huther and Bradshaw. Clinical manifestations of type 2 diabetes, they usually they'll manifest as being overweight, dyslipidemia, hyperinsulinemia, hypertensive, polyuria, polydyspnea, polyphagia we just discussed. You'll have some fatigue, you'll have pruritus, which is itching, recurrent infections, visual changes, paresthesia, and weakness. And next you have signs and symptoms of hypoglycemia and hyperglycemia we're going to discuss. The handout I'm giving you now is a sign on hypoglycemia and hyperglycemia, because we're going to go straight into that after this. Hypoglycemia, they will present with sweating, tachycardia, palpitations, pallor, restlessness, anxiety, tremors. They may have fatigue, irritability, headaches, loss of concentration, visual disturbances like blurred vision, dizziness, convulsions, coma, and death. And usually you'll see those on your NCLEX studies, and also you also will treat hypoglycemia, as we said earlier, with juice or Coke, or feed them a tray, feed them their food tray. Signs and symptoms of hyperglycemia, you'll usually see polyuria, polydyspnea, and polyphagia, which is increased urination, increased thirst, and increased appetite. You see fatigue and weakness and vision changes. And what are we talking about now? This is rapid-acting insulin. It begins to work about 15 minutes after injection. Its peak time is 1 hour, and it continues to work for 2 to 4 hours. An example of this is log and Humalog. You see those as sliding scales given to patients in the morning right before they eat breakfast. They always give them the log. You always want to make sure when you're giving a log, you want the breakfast tray sitting in front of that patient, so when they take that first bite, you want to give them the insulin. Short-acting insulin is better known as R. It reaches the bloodstream in 30 minutes after injection. The peak time is 2 to 3 hours after injection and works for approximately 3 to 6 hours. Examples are Humulin R and Novolin R. Usually R is given, it's basically to take the blood sugar down. It's when the blood sugar is high, we administer this. And you usually have to check it. If you give us some regular R, you just want to recheck that blood sugar in 30 minutes to an hour to see if the blood sugar is coming down. And you want to notify the doctor, let them know that that blood sugar is running high. Next, you have intermediate acting insulin, which reaches the bloodstream in 2 to 4 hours after injection. Its peak time is 4 to 12 hours after injection, and is effective for 12 to 18 hours. Examples are Humulin N and Novolin N, and these are considered your maintenance insulins that basically given in the morning. Either they give 10 or 5 units, depends on what the endocrinologist order or the physician orders to maintain their blood sugar levels, and that's their main. They should take it every day. And then we have your long-acting insulins, which reaches the bloodstream in several hours after injection. It tends to lower glucose levels fairly evenly over a 24-hour period. Example is Levemir and Lantus. These are usually given at night, and you always have to watch your patients real close at night with that Lantus, because we'll drop them. You also want to make sure they have a snack before they go to bed. Like some brown crackers or milk, something to help sustain them, keep their sugars from dropping. And next we're going to move into patient teaching. In patient teaching, we're going to be discussing diabetic foot care. And in diabetic foot care, you want to make sure that you check your your patient's feet every day. You want to look at their feet every day for cuts, blisters, red spots, and swelling. You want to make sure tell the patient to use a mirror to check their feet to make sure they don't have any cuts on their feet. You want them to wash their feet every day. And when you tell them to wash their feet, they want to use warm water, not hot water, because this could damage their feet due to the neuropathy. Also, you want to make sure to keep the skin soft and smooth. You want to put lotion on the skin, because if you don't lotion the skin, skin's going to get dry and cracked. It's going to create sores and they may lose a limb. And next you have smoothing corns and calluses. It recommends that you let a podiatrist do your corns and calluses. And if some doctors tell them they can use a pumice, but most doctors recommend that podiatrists have them taking off corns and calluses. If you can see and reach your feet, you need to trim your toes regularly. If your toenails are brown and yellow and brittle, you do not want to try to cut them. You want a podiatrist to cut them. Also, if you can't see your toenails, you want the podiatrist to cut your toenails for you. So you should have a podiatry appointment. And also, you should wear shoes and socks at all times. Never walk barefoot in your house or outside. Wear shoes that fit well and to protect the feet, because Too tight of a shoe or a shoe that is too big will rub sores on your feet. You want to feel inside your shoes, make sure that they don't have anything inside them that will puncture your feet. So always check your shoes before you put them on. You want to tell your patients to do that. And next we're going to have a case study. In this case study, we'll be talking about a 56-year-old male who basically is non-compliant. He lives a sedentary lifestyle in which he sits at a desk. He does not exercise. He smokes 10 to 15 cigarettes a day. He takes blood pressure medicines such as lisinopril, hydrochlorothiazide, and he also takes metformin for his diabetes, but he's been non-compliant with those. He also was put on insulin, but he refused to take the insulin, saying he was feeling just fine, he didn't need it. And his wife also felt like he did not need his medications and that he was doing fine. And he came in the office, he had a hemoglobin A1C of 9.4, glucose of 219, and a serum cholesterol level of 199, a bone of 24, and a creatinine of 1.9. And if you look at this case study, what puts him at risk for all this? Well, the diabetes. He has hypertension that puts him at risk for heart problems, and with the diabetes, it affects small and large vessels, so it puts him at risk for heart disease, maybe cardiac problems like MIs. He's at risk for peripheral vascular disease because of the vessels, the small vessels in the legs and the large vessels causing peripheral vascular disease. So he's at risk for losing his limbs. And renal because it affects the veins in his kidneys. He's also at risk for end-stage renal disease. And then looking at his lab work, his blood sugars are not controlled, so he needs diabetic teaching on diet, exercise. He also needs to be taught to, his wife needs to be taught how to prepare the meals for him, encourage him to exercise and her to exercise with him so they can get in a regimen together, make him be more compliant with his diet and medications. And he also needs diabetic teaching by a diabetic nurse to help him with this. And that's the end. I'll see you tomorrow. Have a good day.